Hi, folks. So Strongs on Twitter asked me some questions. I'll just read to you the tweets. I do not mean to put you on the spot, but please ignore this if this is uncomfortable. I'm muddling through some links, considerations of religious and creed accommodation to getting a vaccine, and some Indigenous people's vaccine hesitancy, partly due to colonial harm and partly due to other factors. My questions is, are religious and creed accommodations being extended to Indigenous people who are vaccine hesitant, who do not wish to be vaccinated? Never in the history of Canada have they ever given us religious exemption on anything, because that's not how colonialism works. It's the opposite. Um, they would absolutely treat us poorly for ever not doing what they said. So in the TRC, there's lots of conversation about health recommendations, and that need to be implemented, that of course we never see any folks really push on, so it's not really being done. To talk about this a little further, first of all, we'll just answer the questions and then go further. um, Asking because I do not want to exclude due to accidental bad policy. Have any Indigenous people successfully obtained a vaccine exemption due to historical and current mistrust? No. Abuses leading to the personal decision not to get vaccinated? I highly doubt it. I would absolutely be shocked if they got exemptions. The only person I know who got an exemption is because she is definitely allergic to everything. So her doctor gave her an exemption, and she's not status. So by not being status, I think that there are more accommodations to folks who are not status, because it seems legit if we are recognizing churches saying no to vaccinations. I don't know. I don't give a shit about Christian churches, because they've always gotten everything they've wanted because the system is designed. Um, so just to give an example, is that Dina Henshaw, like I remember growing up with her, and she very strongly felt that God was a creator of everything, and these are the folks in charge are Christians. So, like, I'm sure Christians can get exemptions, not that I care too much, but Indigenous never have. In fact, the opposite. Like, we are still being encouraged to be sterilized today. Today, that's how it works. Um, I had my daughter in 2007. They were awful to me about it. And in fact, I just did in my podcast, my family experienced, extremism when it came to showing ID for my 14-year-old. We had our vaccine passports, but they didn't want to let her in unless she showed some government ID, which not only is not the regulations of Alberta, but also just, it was basically an example of how exclude natives from establishments they really don't want natives at. So, there's a lot of historical understanding of how badly we've been treated. Peter Lougheed has the um, rumor, whether you're an immigrant, person of color, Indigenous, don't go to the Peter Lougheed because that's where they kill you. And of course, I found that out after having my child. So, really disappointing to know that now. And then that said, like, I see a lot of my settler family struggle with healthcare. So our healthcare just sucks. And I haven't heard of a lot of people get legitimate exemptions, just extremely privileged white people who take every chance that they can not to vaccinate and be obnoxious and to get exemptions. Again, the only person I know who got an exemption is non-status native, and she has legitimate health concerns. We were actually at a convention together, and she got rushed to the hospital because somebody opened one of those small little packets of peanut butter for their breakfast, and that triggered her um, allergies to the point she had to go to the hospital. So in her case, she got an exemption. But folks like myself who have like high blood pressure, cholesterol issues that they can't really pinpoint, like, we were encouraged to get the vaccine. And I wanted to brag a little about Dr. James McCocus and a few of the other Indigenous health professionals. that actually advocated for us to be the highest priority folks of getting the vaccine because um, they knew that this could be the pandemic that actually wipes us out. So we actually got higher priority based off of that. And so I'm status, so I got it. And my daughter, we haven't applied for her status yet, and I'm afraid to, literally because of the red flags. So folks who may not know, when I go to the hospital, it's automatically federal jurisdiction. And as soon as it's a federal jurisdiction issue, immediately the nurses, doctors, everyone starts discriminating against us. And that's why, social services will be called in right away, et cetera, et cetera. So I've actually been really hesitant to get my daughter status because I don't want her being discriminated against. And if she does give birth, that's what happened to me. And I don't want that happening to her. Um, is it policy? Technically, no. I have yet to meet an Indigenous person who hasn't had that. In fact, the opposite. When we give birth, if we are forced to go to the hospital for any reason, then when we give birth, we have, aunts, uncles, grandmas, grandpas, like all the elders in on standby, so that they know if they're going to come try to apprehend the child, that that they have a good support system to give that child to if they will not give it to the mother for whatever reason. So like that's the reality for healthcare right now. I got my vaccine because I know I will be discriminated against in the hospital setting and by doctors. To this day, I don't believe my doctor believes me when I say I don't smoke and I don't do drugs because, or I don't drink alcohol because of my fatty liver and my heart, and they just don't believe me. And that's how shitty our healthcare system is. And then because I've recently moved to Lethbridge, there's no doctors here. So I'm going to try going to the blood reserve to, try to get my prescriptions and such that I need to get. But for the most part, it's really depressing being an Indigenous person. And I'm of privilege. I have a vehicle. I can go to a hospital. I can go to a doctor. Um, that's not the problem. The problem is the extreme racism we face just trying to access some of these things. So the vaccine hesitancy, don't blame them one tiny bit. For a lot of Canadians that may not know, the original vaccines that were tested on Indian residential school kids, and as well as health, diet, and cow's milk. Some other dietary experiments were done on us for Canadians, so that you can have your recommendations of vitamin D in cow's milk or whatever added vitamins that they put in there, and they used us in residential school as the guinea pigs. So yeah, that's what I got to say about that. So yeah, there's a lot of vaccine hesitancy, but Dr. James McCocus, a lot of the health clinics on reserves and just Indigenous health professionals in general have been really working hard behind the scenes to encourage everybody to get vaccinated, because one, we don't want to die of COVID-19, but two, we want to protect the elders or the babies that can't get vaccinated. A lot of us have autoimmune disorders because of all the experiments and all of the stress and intergenerational trauma we've experienced by the Canadian government, by Canadian citizens. So yeah, I hope that helps answer that. I was hoping you could jump on, but I understand that can't be for everybody. So thanks.